I'd like to welcome all the parents who have joined us for this Zoom meeting webinar today. At the outset, I'd like to apologize personally as well as on behalf of NeuroGen for the cancellation, or I would rather call it rescheduling of the seminar we were to have in San Francisco. Most of you are aware of the reasons. Our country was in a state of war, and we weren't sure at the time last week, where things are going. Things were pretty much heated up over here, and we were torn between waiting to see if things settle, in which case many of you who may have made your travel plans might not be able to cancel them. So, about a week ago, we took the difficult decision of not coming to America. The reasons, apart from a little erratic flight schedules, was the fact that I personally felt the need to be in the city, in NeuroGen, should the war get escalated, and our city, Mumbai, was in the range of possible escalation. And should something unpleasant, unwanted have happened in the city, well, I would want to be with my patients who are here, with my people over here, and I felt it would not be right to be in a different country when our own country was in a state of war. Uh, so we canceled it. I take complete responsibility for the cancellation. I also like to apologize to Shaq and Soma, to Anamika, Pushkar, Apurva, all the parents who have arranged this. I know you've had a difficult time. A lot of parents have been upset, some have been angry, but I just wish everybody would understand that when a country of yours is in a state of war, and uh, you know, it's like this has happened after so many years. I can't even, the last time this happened was 1971. Obviously, you want to be at home with your own people to look after them. So, my apologies to the parents who arranged this. However, I do promise you that we will come to San Francisco, because I was told that apart from listening to my talk, a lot of parents wanted to actually meet me in person. So, right now it's 3:30 a.m. in the morning in Mumbai, and I'm here because we decided that whatever was the time of the talk in San Francisco when we were supposed to take it, well, we'll do the Zoom meeting webinar at the same time. So that's why we are here. Um, I just hope all of you understand. Uh, Soma, I hand over the presentation. I hand over to you now.
Thank you, Dr. Sharma, and welcome everybody to this Zoom call. I am so happy that everyone is able to, whoever is able to join during this time. Unfortunately, like Dr. Sharma said, things were out of our hands. We were not able to make it to SFO. Shaq and I really wanted to come. Unfortunately, Shaq is not available either. He is at a different travel. But I wanted to come and join you guys because this is very close to my heart. And Dr. Sharma and I and the team, again, apologize on the whole behalf of all of us. We are all one team. We're all working together for the special needs community. And so thank you, Dr. Sharma. Um, all of you guys, thank you guys so much for joining us. I wanted to jump on here and tell you guys a little bit about Shaq and Somi. I'm sure most of you guys know us. We are from TikTok, and we've been on TikTok for 3 years. We have started lives actually during COVID time. So it was 2020 when we started, and that was when we started to share our journey with autism. Our eldest son is 14 now, and he was diagnosed with autism at 3.5. He started to show signs between the ages of 19 months and 20 months, where he regressed and he became nonverbal. He had some behavioral issues. There was a lot of things that we started to notice about him, which we were wondering what happened. For those of you that watch us on TikTok Live, you guys obviously know our journey and we have shared it with the community because we know how difficult it is when a child is diagnosed with autism and figuring out what is going on. And when you do figure out, where do you start to help your child? So when Shaq and I do our TikTok lives, we come on and that's exactly what we do. We try to help parents understand that they're not alone, that there is a huge community, as small of a community that we are, but it is a very huge community out there. And all you have to do is connect. When our son was diagnosed with autism, he was nonverbal. So he was diagnosed with nonverbal autism. He did have some behavioral situations, such as repetitive language. Sorry, not repetitive language, repetitive behaviors. Idris did not start talking, I would say using words, until about six and a half. Um, when Idris started using words during the period of, I would say, 20 months till about six and a half, Idris was able to point at everything that he needed. And then as soon as he was diagnosed, we started an early intervention program with our county. So we put him in a school that provided children with autism services. We also immediately put him in ABA therapy, speech therapy, occupational therapy, and actual physical therapy when Idris was first diagnosed. Um, when we did all of that, we started to notice some changes in Idris that was helping him. And we did a lot of the support that he was receiving from therapists. We also decided to do the same support at home. We were very involved in his life. We were always advocating for him because Idris had no voice. Idris did not talk until he was six and a half. And even when he did start talking, he was only talking with just one word sentences. He was able to request what he needed, but other than that, he was not able to do anything on his own. Um, my focus here, and I'm sure all of you that do have children with autism, is early intervention is very important. You have to, as soon as your child is either diagnosed or even prior to diagnoses, you have to pay attention to your children. You have to make sure that, is your child hitting milestones? My son hit every single milestone up until 19 months. As soon as he hit 19 months, it was a huge regression. And I didn't know because we had nobody in our family that actually was diagnosed with autism. So early intervention is very important. As soon as your child, there is a slight mishap and you have a gut feeling as a mother or a father, and you notice that something is off with your child or he's not talking by a certain age, you need to find help as soon as possible. We went to three different doctors and our doctors, the two prior kept saying, "Oh, he's a boy. Don't worry about it. It's gonna be delayed. It's naturally delay in a boy, his talking." Um, so we believed it. And then we noticed that other kids his age were talking, they were responsive. Idris didn't know his name, so he had no idea who he was. And that's when we knew something was wrong. I knew something was wrong. It was very difficult for Shaq to accept that anything was wrong with Idris because he was our first child. But as soon as we both realized that something was going on, that's when we started and we connected with a developmental. So it was a neurodevelopmental pediatrician in our area. We connected with them, and they took about a year and a half to finally diagnose Idris. When Idris was diagnosed, that's exactly where we kicked off early intervention. We got him into a school in the county. We got him into all these therapies, and we started our basically our journey at that time. Um, Fast forward a little bit, Idris has always been in an autism-based classroom. So We have not pulled him out for any specific reason. He's always been part of an autism-based classroom, and we've always kept his therapies. We're on top of it. We've even gone through parent therapy where the therapist has taught the parent how to react towards specific behaviors at home. Children with autism need a lot of work. Children with autism need mother and father, if they're available, as well as the community. The community needs to understand that your child has autism or your child has a developmental delay. It kind of goes hand in hand until finally the child is diagnosed. Also, um, parent involvement in a child with autism, as well as other kids. I don't discount any other kids. I have three children. So my eldest has autism and my other two do not. But children with special needs and sense of autism need a little bit more additional support from not only the parents, but from the siblings as well as the community around you. When Idris was diagnosed with autism, we relayed that message to our entire family. There was no shying away from your child. There is no saying that your son is okay and you have to move forward. So raising children, it already needs a community to raise, but raising a child with autism is a separate community. And if everyone is involved, then you have the support from every single person. I have to tell you guys that moving forward, um, let's say Idris is 15, going to be 15. So when he was 12, the summer of, I believe it was 2022, is when I first attended Dr. Sharma's seminar here in Virginia. It was my first time. And going into his seminar, there was a lot of information that I had no idea even existed in regards to therapies with autism. Um, so we went to the same seminar that you guys are attending today. And when we sat down as parents of a child with autism, you want to do anything in your power to help your child. At least we did. We wanted to make sure that we did not miss anything moving forward with Idris. We went through every single therapy in that Northern Virginia was able to give us. We went through any services in the local communities that was able to give help to Idris. And we also did everything that the therapist was able to teach us here at home. We did not want to just leave him with the therapist for 2 hours and then at home do nothing because that doesn't help. The therapist only sees him for 2 hours. They don't know your child. They only know what information you're providing and what behaviors arise during the meetings with the therapist. You, as a person, have to sit down and speak to the therapist. You have to advocate for your children. You have to speak for your child. In the schools, I am very involved with their teachers, with their therapists, with the schools. You have to stay involved with them. Um, so moving fast forward again, with autism and being involved in a child's life that has autism, there's so much back and forth. There's so many days where your child surprises you and you're just like, whoa, what just happened? How did you even know how to do that? Or what did you do? They're very smart children in their own way. And as parents, you have to be the advocate for your child. If you don't support your child, even as soon as they are diagnosed, then that's a loss for you because the child needs the parents 100%. Even I would say 100%, 110%. There's moments where Idris has showed us where he does something and we get shocked because we had no idea that he could do it. Don't underestimate your child with autism. Your child with autism, you have your hard days, but every emotion that you're pushing out, the way you talk to them, the way that you communicate with them, they understand every single gesture that you do on your face, on your hands, on your lips, on your eyes, everything. They understand everything. Moving forward to stem cell therapy, which Dr. Sharma is going to speak about. We did go through it. We did one shot 2 years ago. Idris is now going to be 15. Unfortunately, within the 2 years, we were not able to go back for a second shot. Idris finally was able to give me his opinion. And when we wanted to go back, Idris said, I'm not ready. So when your child actually speaks for himself for the first time, then as a parent, you're going to respect his feelings. So we did not go back. But I can tell you the changes that we saw. We went with no expectation at all. We went with zero expectation. My child was already 12. He was already hitting puberty at that time. And after a stem cell, when he came back, Idris was doing this thing with his hand where it was a comfort. It disappeared. It no longer happened. And it only took maybe 4 weeks in. Idris started to become so independent at home where he knew how to use the air fryer, the microwave. Um, he knew that he had to put on gloves to touch anything hot from the microwave. He became this child that I had no idea was even in him. I can now carry, and it's been almost 2 years. He's gonna be 15 this year. I can now carry a 2 minute conversation with Idris, and I couldn't do that before. I would only have to ask him yes and no questions. And now I can have the two minute. After that, I could have the 2 minute conversations. Idris has showed us situations in his life where Shaq and I are both shocked. And for those of you that follow us on TikTok, Idris is on there. So I'm not hiding anything. I'm not saying anything that is just out of the blue. Speaking of Idris, he's right behind me. Um, um, I miss you too, baby. Sorry, guys. So those of you that do watch us on TikTok, you do see the changes. And so the only thing that I'm going to end here is that just listen to Dr. Sharma, just hear him out. This is a community that we are building. I understand we were supposed to be in SFO this weekend. I truly, deep down inside, wish I was in a room with all of you guys in person because this has been my passion since the time that Idris has been diagnosed. Because I know how difficult it is that having a child with autism and not having a child, I'm sorry, and not having family around you understands where you're coming from because it is really difficult. This journey is so long. This journey has very highs and lows. This journey, if you are not positive in your life with your child, will bring you down really easily. So before I hand it over to Anamika, and then Dr. Sharma, I just want to say, just listen to Dr. Sharma's research. There is literally 100% research that is in here, and you'll be amazed. And that's exactly what my feeling was 2 years ago. Anamika, I'm going to hand it over to you. Thank you so much for everybody that's joining. Apurva, I'm not sure if she's on the call. I can't see a lot of people on here, but thank you so much for your back end work. For those of you that have reached out and is from Shaq and Somi's live, I do want to tell you guys, thank you guys for your patience. Again, I cannot apologize how much that we could not be there in person to you guys, but you guys follow us on live and we are consistently there for every single special needs community that's out there that just needs a emotional support. And that's all I have here.
Thank you so much, Soma. Thank you. That was amazing. Very touching. Anamika, you want to take
Yep.
over?
Yes. Thank you, Soma. So I want to start here by thanking Dr. Sharma and the organizers of the entire team for giving me opportunity to share my journey as a parent raising a child under special need. Once again, apologies for not making it to in person, but I'm so glad that we all are able to make it virtually. My name is Anamika Pushkar, and I am a mother of two children. My older one is 11-year-old who is under spectrum, and my little one is 5-year-old who is a neurotypical child. Our journey began when he was 2 years old. We started doing intervention, which Soma also talked about it, early intervention. And we got to know we had his evaluation done from the county. I'm again thankful to the county that I'm here and I got that opportunity to have his evaluation done and he became eligible for the education being provided by the county. We started from there. Still, he was not medically diagnosed that he is a child who is under spectrum. With lot of interventions, we did lot of interventions definitely. He was finally medically diagnosed when he was 7.5 years old. Then we can say our real journey of autism started because after that only we started doing a lot of research. What all things we can do to help him. Long story short, I won't take much time, but I would say after doing so many interventions, we finally ended up doing stem cells for our son. When he turned 10 years old, we had his first round of stem cells done, which was done last year in the last week of March. And I would like to mention, focus more on that. So once we are done with his first round of stem cells, the first thing which we saw in him that he started expressing himself. He became aware of the environment. At least he started coming to us if we are doing something. He shown that he wanted to involve in that, whatever we are doing, whatever his little brother is doing. These things were not there before. He started following multiple commands. Like if we say it's time to read book, he started reading book definitely. He was completely nonverbal. So he started following multiple commands means I would like to give example by that by saying that if we asked him to read a book, we set a timer. We just asked him, can you go and pick a book? And since timer is on, can you read book? So he goes to the place where he keeps his books. He picks the book, he reads the book until the time goes off. So these things were not earlier in him before. He was not even able to read books because, but I cannot say, but he was using, since he was nonverbal, he was completely dependent on a device to communicate. So he was reading book using that particular device. But now he reads the book verbally. That's the biggest thing we saw after doing stem cells. And I would like to mention that. Next biggest thing happened is he started recalling his past events. I would like to give example one more time by saying this. After first round of stem cells, he fall down from his hoverboard. He got his He got hurt at some of the body parts like his right shoulder, his ankle, his waist part area. So after a couple of months, but at that time when we asked him, he was able to say that where he got hurt. And after a 1 month, one of our friend visited our house and we had a discussion one more time, and he was able to recall what happened exactly at that time. So that's again the biggest improvement we saw after first round of stem cells. He started greeting people. Earlier it was very hard because he needed multiple prompts to greet people. Now at least if anyone is greeting him, let's say if somebody is greeting him good morning, it is not necessary he is looking at that person, but he is listening and he greets them back. And it is consistent now. Other things is like the repetitive behaviors like his stimming, flapping hands, those all got reduced after first round of stem cells. So after seeing these many changes, as per the protocol, also he needed 2 rounds of stem cells. So we were ready for his second round as well after 6 months. So after 6 months, we again went for his second shot. And after second shot, what we saw, we noticed that he started answering some of the open-ended questions. Means, let's say if we are reading some book and we are asking, can you think of something which is hot? Can you think of something which is cold? So he thinks and he is able to answer. Like one day his speech therapist was working with him at home. So she was reading book with him and she just asked randomly, can you think of something else which is cold? He answered, ice. So these kind of things started coming after second round of stem cells. The words started becoming more clearer. Like now, if he reads book and if some difficult words comes in between, he tries to break the syllables of that word and he tries to read that whole word. But he reads it correctly. Although still we are working hard on making his speech clearer, we are hoping it will come one day. And the next thing we saw, his focus has been increased a lot now. After second round, after first round itself, his temper tantrums was almost gone, but not completely, I would say. But after second round, his temper tantrums is almost gone. Is I have not seen his any temper tantrums after we had gone for second round of stem cells because he can tolerate sitting for a long time with his younger brother who basically most of the time he engages him in reading book, either coloring or playing board games. Earlier he used to annoy and he used to shout, he used to run away, but now just as much as his little brother wanted him to sit, he sits next to him, he works with him, he follows his direction. And sometimes even my little son becomes therapist for him as well because he observes how the therapist works with him at home. Sleep has become better, I would say. Not 100%, but yes, he's getting there. At least earlier, when he is used to up in the middle of the night, after that, it was hard for him to sleep. But now, if he gets up in the middle of the night, after 1 or 2 hours, he sleeps by his own. Hand eye coordination has been increased a lot. He's able to catch all size of balls. He's able to kick at the target if we ask him. So, those physical activities, those improvements have come along. So after second round of stem cells, we have seen, as per his school teacher as well, what we get. whatever they work with him, he focused. He's so much focused now. Earlier he used to distract a lot. Even though if some any other person is present next to him, he used to get distracted a lot. But now, no matter what, if he's doing something, he just does it. Nothing disturbs him now. So that again, another improvement we saw. I won't say we are not facing issues. We are still facing issues, but we are working for that. And we are again going for his third round of stem cells in July end before his school restarts. We are still following NeuroGen guidelines, everything we are working on. So these are all things we saw improvements on him after stem cells, after second round of stem cells. And with that being said, I would like to hand over to Dr. Alok Sharma to give you more insight on his medical intervention. Thank you so much.
PPT. Thank you so much, Anamika. That was very, very touching. Thank you for sharing such a personal journey. And Soma and Anamika, with your permission, may I proceed with the talk?
Yes,
Hey,
please.
Dr.
Yes.
Sharma, it's Apurva. I'm here. I was wondering if I could say a few things.
Oh, please go ahead. Please go ahead, Apurva. I'm
I
sorry.
sorry, let me take off the camera. I actually just got a text. People wanted me on, and I am gonna ask my son to say a few things. He's really excited. Namish, do you have anything to say?
Yes.
What's going on
Hi,
right now?
Namesh. Hi, Namesh. Good to see you, buddy.
Namesh.
I'm so sorry I couldn't make it to SFO.
That's
We will meet again soon.
okay.
So guys, he has actually gotten stem cells too. We just had his IEP last week. He has officially graduated majority of his program. He's fully in general education, with just 20 minutes of a breakout at the end of the day for a quick check-in. And I'm gonna leave it to Namish. Namish, do you have anything to say?
Yes.
Okay. Can you say a few words about Dr. Sharma?
You're cool
Oh, thank you.
Right? What else?
and nice
And what else?
and amazing.
Oh wow, what
Oh,
else?
thank you.
Awesome.
That is so cute.
Awesome.
Oh, that is the
Okay.
nicest thing I've heard in a long, long time. Thank you so
Great.
much.
He's great. Okay. What else?
Good.
He's good. Okay. And
Very, very super duper good.
oh, super duper good. Okay.
Oh, that is so sweet. Thank you, Ramesh. Thank you so much.
You're welcome.
All
If
right.
anyone has any questions, actually, Manish is able to have a back and forth conversation with you guys. So feel free to post any questions. He will answer it. He does have his older brother who's also on the spectrum, so I have both kind at home. He's on more of a mild to severe end, and he's really high functioning. If there's anything, let us know. Someone can ask the question, and I don't know where to look for the questions. Or someone can have a back and forth conversation with him and he'll do it.
So at the moment, Apurva, there is actually no questions in the chat. So Dr.
Okay.
Sharma can actually go ahead if he wants to.
Sounds good. Okay.
Thank you, Purva. Thank you, Ramesh. Thank you.
Welcome.
No, yeah.
All right. So with that, I will start with my presentation. I hope the PPT is visible to everyone. Apurva, Soma, Namika, is it visible?
Yes,
All right.
it is visible.
So for those of you who've joined late, I started this Zoom meeting webinar with an apology. And the apology was for not being in SFO. It is something that we really wanted to do. But the war situation in India prevented us from, made it difficult for us to leave the country. Our apologies are not just to all the attendees and parents who are looking forward to seeing me, but to Shaq and Soma, to Apurva, to Anamika and Pushkar, to all of you people who work so hard behind the scenes to make this happen. But I do assure you and promise you that we'll be in SFO sometime soon. So with that, I'd like to start with my talk. I am basically a neurosurgeon with special interest in the field of regenerative medicine. And, I'm here in India at 4 a.m. here, and you guys are in America, so this is a communication between us. Before I give any talk, I always present the disclaimer that this talk is for information purposes only. This is not a substitute for a medical consultation for which you should consult your regular doctors. You should know that each child with special needs is different and requires individualized treatment interventions. The information in this talk is generalized, and all the clinical results I've mentioned in this talk have been published in peer reviewed medical journals. This is very important because this makes the information I present authentic because it has been peer reviewed and verified by medical journal teams. So, why are we here? We are here because we have these wonderful special needs children. And well, all our children are wonderful, but when a child has special needs, the journey becomes challenging, more difficult, because there are a lot of things that these children are not able to do, and they need special support and assistance. And what makes it more difficult and challenging is the fact that, uh, you know, you go from pillar to post, you go to doctors and therapists and rehabilitation centers, and you're told one thing: there is no cure for this, there is no treatment for this except rehab. And that makes it emotionally very challenging because, in your minds, you're thinking, well, there's so much science, there is AI, there is technology, we are planning to send people to Mars. There is so much stuff happening, genetic therapy, biotechnology. And why can't my child be helped? Uh, so here's the good news. I'm going to present to you the science, the pure science that has been evolving in the last few years, that is now in a position to be able to help our children lead close to independent. We don't use the word normal anymore, but neurotypical lives like the lives that we live. So, my talk is divided into four parts. The first is what I call shifting minds about autism awareness and acceptance. And in this part, I'm going to share what has happened in just the last 3 months. In the last 3 months, suddenly there is an amazing focus on autism. What I'd not seen happen in the last 15 years of our work has been happening in the last 3 months. We look a little bit at autism. We will look at what is new in the understanding of autism, that is the science. And then, of course, what is new in the treatments? How does the science help us to treat? So, the first part is about autism awareness. So, we are now moving from pure awareness to to acceptance, and the focus is shifting to understanding what is going on. So, the good news is that screening and diagnostic method at kids has got much better, so we can pick up autism at a much earlier stage. So there is a new light and focus on autism. The two very powerful people in America, President Donald Trump has, in the last 3 months, I know of at least three occasions where he has spoken about autism. I've never seen any president of the United States or any president or prime minister of any country talk about, um, you know, um, autism. And here he has been talking about it repeatedly. And then the man in charge of health in America, RFK Jr., Robert F. Kennedy Jr., who's now the health secretary, has been in multiple interviews, been talking about autism and its increasing incidence. We also have among the two richest men in the world, Elon Musk, who is now in the limelight for various reasons, and Bill Gates, who has sort of retired a bit from a public life, but is obviously well known. And we are going to see 4 short videos of what these 4 people have to say about autism.
Our goal is to get toxins out of our environment, poisons out of our food supply, and keep our children healthy and strong. As an example, not long ago, and you can't even believe these numbers, 1 in 10,000 children had autism, 1 in 10,000, and now it's 1 in 36. There's something wrong, 1 in 36, think of that. So we're going to find out what it is.
So that is the President of the United States talking in the Congress. This is the US Congress. He's talking about autism. And here's
The
RFK
ASD
Jr.
prevalence rate in 8-year-olds is now 1 in 31. Shocking. There's an extreme risk for boys. Overall, the risk for boys of getting an autism diagnosis in this country is now 1 in 20. And as high in California, which has the best data collection. So it probably also reflects the national trend, 1 in 12.5 boys. This is part of an unrelenting upward trend. The prevalence 2 years ago was 1 in 36. Since the first ADDM report in 1990, which was 1992 births, autism has increased by a factor of 4.8. That's 480%, I believe. The first ADDM survey was 22 years ago when prevalence was 1 in 150 children. In all the core states, the trend is consistently upward, and most cases now are severe. So about 25% of the kids who are diagnosed with autism are nonverbal, non-toilet trained, and have other stereotypical features, head banging, tactile and light sensitivities, stimming, toe walking.
So that was the Health Secretary of the United States talk of autism.
You've talked about
And let's see what Bill Gates has
that
to say.
if you were a kid today, you would probably have a diagnosis of autism. What makes you think that?
Well, the term, particularly when they say on the spectrum, you know, that's gone from being a narrow, very narrow thing to now pretty broad. And I was very slow to develop socially. I kind of rock. I concentrate intensely. My teachers were so confused that in the same grade they said put him ahead 1 or 2 grades, and another teacher said push him back 1 or 2 grades. You know, so that was a dilemma. My energy, my obsessions, fortunately, writing software being one of those, so that worked out well for me. You know, marked me out as a very different kid in terms of my neurological style.
Your ability to focus as a kid and solve problems in your head, I mean, that you write about, it became kind of a superpower.
Absolutely. I wouldn't trade it despite the other limitations that it came with.
That was Bill Gates, who for the very first time in his life, just recently, about 6 weeks ago, in an interview to BBC, spoke about the fact that when he was younger, he had all the symptoms of autism.
I'm actually making history tonight as the first person with Asperger's to host SNL. Or at least the first to admit it.
Understand.
So that was just to sort of show the focus in the last few months on autism, when the 2 most powerful politicians and the 2 richest men in the world are now talking about autism. Now, next, I'd just like to, before I get on with my subject, there is a short movie clip from a movie called The Accountant, which I like very much because in just a couple of seconds, it very beautifully describes, you know, how our children with autism are not less than, they are different. And maybe they know much more than we think they know. And maybe we just haven't learned how to listen. So I think in a very small video clip, it shares the view today, how we view autism today. So now coming to what exactly autism is. Basically, we know it's a neurodevelopmental disorder. It was first described in
Dr. Sharma, we
1943.
lost your voice.
Lost my voice. Hello, can you hear me now?
We are able to hear here.
Yeah.
No problem.
May I go on? Soma, can you
Yes,
hear me?
yes,
Yeah.
yes, it came back.
So, like I said, autism is a neurodevelopmental disorder. It was first described in 1943. It's diagnosed in the first 3 years of life. We now refer to it as a spectrum disorder, and boys have it 4 times more often than girls. And the main problems in autism, we all familiar with, is challenges with social interaction, communication, and repetitive behaviors. So this is what is not known to the general public, and this is what President Donald Trump has been repeatedly talking about, and this is what RFK Jr. has been talking about. That now this is a graphic from um actually the CDC itself and from the CDC website. And as you can see, it was 1 in 10,000 in 1970. And you can see from around 2000 onwards, it is just spiraling and spiraling and spiraling. And this was 2023. As per RFK Jr., the latest figures are actually 1 in 31. This is an increase that is unprecedented. We have never seen any chronic condition that has increased so much, so substantially, and so exponentially ever in medical history. We've never seen anything like this. And obviously, something is wrong. There's something that is happening in our society that our children are maybe having to go through whatever they have to go through as children on the autism spectrum that may just have been preventable. So, a lot of our work is also now focused on trying to find the causation, and maybe we'll be able to prevent this disease earlier. So, this means that presently almost 70 million families are affected, which is 1% of the world's population. And a question that you keep asking, parents keep asking is, why? Why did my child develop autism? And this is really something that we may not have an answer to. But the causes of autism can be divided into two: established causes and what are called controversial causes. The established causes are genetic mutations, advanced parental age, maternal health issues during pregnancy, birth complications. The controversial ones are vaccination, and that's a big debate in America right now. Exposure to heavy metals, exposure to electromagnetic radiation from cell phones, and things like that. So, genetic and environmental, and we know there could be a genetic thing because we've seen twins, we've seen triplets have autism. And if I were to divide, look, the environmental causes broadly, I would talk of prenatal, antenatal, intestinal problems, exposure to toxic chemicals, and the use of mobile phones. So, the prenatal and antenatal causes, which means problems before, during, or after birth, are any maternal infection is known to increase the incidence of autism. Maternal diabetes is known to increase depression, and the use of antidepressants increases the incidence of autism. The older age of the father is one major cause, and premature birth and birth complications. So there is a wide range of reasons. Old age of the father is again significant because a 45-year-old father is 3.5 times more likely to have a child with autism, as compared to somebody in their early 20s. Heavy metals, that's another big topic all by itself because these do get transmitted from the placenta to the child. There is a discussion on, because the incidence of autism has become very high around the year 2000, where a couple of things happened. One was, mobile phone usage and the 3G, 4G, all of that, it became far more widespread. The MMR vaccine was introduced. And also, something else that I'll talk about is the introduction of folic acid. So, all these things happened around the same time when the incidence of autism has gone very high. So in 1998, Andrew Wakefield published a paper in The Lancet that claimed that there was a link between autism and MMR vaccine. However, this publication had to be retracted, and subsequently, there were many who published that there was no link between MMR vaccine and autism. But the debate is still on, and so, a lot of work is happening in America. A committee
There
is
have
set up to
been,
look
as
into
I
it.
understand it, dozens of studies done all over the world that make it very clear that vaccines do not cause autism. Now, you just said, if I heard correctly, well, if the evidence is there. The evidence is there. That's it. Vaccines do not cause autism. Do you agree with that?
As I said, I'm not going to go into HHS with any preordained.
I asked you a simple question, Bobby. The studies all over the world say it does not. What do you think?
Senator, if you show me those studies, I will absolutely, as I promised to Chairman Cassidy, I will apologize.
That is a very troubling response because the studies are there. Your job was to have looked at those studies as an applicant for this job. All right.
So that's the controversy. Again, so we divided into environmental and family factors.
Around 1 year.
Now what we look at is a couple of parents, what it is like for parents to have a child with autism. What are the challenges and difficulties of their journey? We're going to look at a few parents, talk about it. What was it like before? And at the end of the presentation, we'll look at the same parents talking about where they are now.
At around 1 year, she had speech, but at around 1.5, she went mute.
When she was 1.5 years old, she was not giving an eye contact, not mixing with the children's, and not replying to her name. So that actually triggered something is wrong.
Shihan was not at all talking, it's just everything is sign.
His focus is very poor, but very focused.
My son was completely speechless.
Never seen you talk, then you regress.
If you cannot speak, it's not safe. Even if someone is bullying you, you cannot even say and ask for help.
Challenges were really in his ability to listen to longer instructions, his ability to sit, process that, even talk.
Some of the kids tiptoes. I would see it with my girl.
Noticing more and more of abnormal symptoms, which was hard to digest.
Was not able to control himself in terms of toilets. He used to wear diapers. He wasn't able to, very picky eating.
Whenever you open the door, we had the threat of he running away. So we had to keep him contained. So unpredictable behaviors.
He was running away. He wasn't sleeping. I would stand up the whole night holding him and he would cry if I put him down.
We took her to the pediatrician. Then we got a shock. Oh, there she is suffering from autism.
When I was told about the diagnosis, first I saw the end of me. I couldn't handle the end.
It's like we lost our son. He was here with us, right with us, and he is not even responding to his names.
So then what is the solution? You have to go to therapy and all.
We had several years of therapy. That did not change much for me for 8 years.
Therapies was not making any changes. Pediatricians and all say that, oh, nothing can be done.
When I saw Dr. Alok talk about the amazing results that he's seeing based on stem cell, I don't want to wait. My child is losing his time.
Now we will listen to the same parents a little later on. So now what is new in the understanding of autism? We're going to get a little into the science. So this is where we are, and we're going to look at three aspects: what's happening in the brain, we are going to look at what's happening in the blood, genetics, and the gut. So we're going to look at the neuroimaging findings, what the brain scans are showing, PET, CT scans, and MRI. We are going to look at the biochemical findings, what is happening in the blood. We look at genetic findings, and we're going to look at gut dysbiosis. So what I'm going to present now is our own research. We have treated so far over 6,000 children with autism. So what we have found in this process, I'm going to share. So we have two kinds of brain scans. On the left, you see what is called an MRI that shows you the structure of the brain. In most countries, they don't even do an MRI of the brain. In some places, they do. But the MRI doesn't show significant problem, although we have found some interesting findings. But what we do is this color scan you see on the right. This is called the PET scan. In the PET scan, what is green is normal. So, we've done research on this, and neurotypical children or adults have everything appearing green, which is normal metabolism. What you see light blue, these are areas which are hypometabolic, and they are areas which are not working properly, or they are inactive. So whatever is light blue here, and whatever is yellow is brain that's working more. So I'll discuss a little bit about my findings shortly. So what we have found is there are parts of the brain, these are all technical terms, the amygdala, hippocampus, parahippocampal gyrus, cerebellum, etc., that are working less. Now, the most important of these is the cerebellum, or what we refer to as the small brain. In almost every child with autism, this part of the brain is not working. This is the part of the brain that's referred to as the automatic pilot, the brain that does the processing, the brain, that part that connects to all other parts of the brain. So this is like a it's a smaller brain, but a very, very important part. And in every single child, we found that this is not working. Also, these medial temporal areas, they are blue, not working. This is responsible for speech, attention, learning, coordination, etc. But yes, we've also found problems in the sensory area in the brain, which explains their sensory issues. So the sensory part is affected. But we found something more interesting. We found that there are parts of their brain which actually work more. There are some parts in the frontal and mainly in the occipital or visual area that are working more than us. So, that's why now there is a complete new focus. Instead of looking at what is not working, we can now look at what is working more. And it is this increased brain activity that accounts for somebody having symptoms of autism becoming a Bill Gates or an Elon Musk. So there is increased activity, and we've been doing a lot of work trying to understand this. And all this work is published. This is a paper in a prestigious journal, the World Journal of Nuclear Medicine. And there's this paper written by us. It was among the first in the world that very clearly showed which parts of the brain are not working in children with autism. And, it's surprising that there's such a huge increase, and nobody had even looked into the brains of these children, and nobody had even identified what parts of the brain were not working. But what we found in our research was that the brain activity over the years, like this is at 2 years, at 4 years, 6 years, the brain activity keeps on decreasing. So this was an interesting finding. Now, if you compare this to neurotypical children who are growing normally, the brain activity increases over the years. So from 5 years to 10 years to 15 years, in neurotypical or what we call normal children, it increases. In children with autism, it actually decreases. But there is something interesting here. And what is interesting is that in the early years, the brains of children on the autism spectrum are working more than that of neurotypical or normal children. But then gradually it declines. So this is the importance of early intervention. Very often people say, well, we'll do the treatment later, we'll wait and watch. The longer you wait and watch, the longer is the gap between a child with autism and normal, because this is where we want our children's brains to be. So this is a smaller gap to bridge. This, as the child becomes older, is a bigger gap. This is also our own original research. This is a paper published by us. We looked at the MRIs, and what we found was that there is a connection between the right and left part of the brain. This is referred to as the corpus callosum. And we found that the corpus callosum, the connection or the bridge between the right and left brain, is actually working less. Not working less, it's actually smaller in size. So obviously working less. The volume of it is smaller as compared to neurotypical or normal children. So this was again a very interesting finding, that the bridge between the two brains is smaller as compared to neurotypical children. Now the biochemical of findings in the blood. So we've been focusing on something called the mitochondria. The mitochondria is like the battery of your mobile phone. You can have the world's best mobile phone, but if the battery is weak or discharged, that phone has no use. So the battery that charges our cells is something called mitochondria, and we've been looking at this in some detail. We've been looking at the folic acid levels Just to, this is a little technical, but I'll try to make it as simple as possible. Folic acid or vitamin B9 is actually, we take it in supplements, we take it orally, as folic acid. This is the way we take it. But the body absorbs it as something called methylfolate. So this is how we take it. Folic acid is how we ingest it. This is how the body absorbs it. Now, in autism, there is a genetic defect because of which folic acid, which is inactive B9, cannot convert into the active and usable form. So this is a problem we have been finding in our children. So apart from that, we've been looking at what's happening in the brain. So we are finding there is a chemical called glutamate, which is high in the blood and in the cerebrospinal fluid or the fluid within the brain. Likewise, there's another chemical called GABA, which is decreased in both. But something else called serotonin is decreased in the brain, but increased in the blood. We found that dopamine, norepinephrine, oxytocin, all of these are decreased in both the blood and the brain. So there is a lot of, and this is all our research. What I'm showing you is our own research. And this explains many of the symptoms. So we are now having a deeper understanding of the chemistry, what exactly is happening in the brain that is resulting in our children having symptoms of autism. Now, the genetic findings. So what we have found is there is a gene called the MTHFR gene that converts inactive, unusable folic acid to active, usable methylfolate. And this gene converts it. And we have found that in 80% of our children, there is this mutation, which means that in these children, in our children, folic acid is not being converted. So what happens is we keep giving our children supplements without realizing that actually the form in which we are giving it, the body is not able to absorb it. And this results in higher levels of these in their body. So what we have found is that there is a gene mutation in 80%, which is very high. We found our children have higher folic acid levels, and despite this, they are being given supplements, which is increasing. We are finding something called homocysteine levels are high. This is normally found in adults who have a brain stroke or a heart attack. They have high homocysteine levels. We are finding these high. We are finding a majority of our children have low vitamin D levels. And we are also finding there are some issues with the mother. Certain vitamins are higher in the mothers. Then the gut, we have been doing a lot of work on the gut. And, we found that, that 70% of our children have some or the other gut issue. And this is again our data. We found that a large number of our children have E. coli infection. Many of them have a fungal infection, protozoal infection. So these are the infections we have found in the gut of our children. So now we come to what is new in the management. So we've looked at the increasing awareness. We've now got a better understanding of what's happening in the brain, what's happening in the blood, what's happening in genetically. So that was the science, and now we come to the treatment. So what is new in the treatment? So up to now, the only treatment that you were told was rehabilitation. But now I'm going to talk about two newer treatments. One is cell therapy, and the other are some therapies called integrative therapies. So the old thinking was that the nervous system, once it is damaged, you cannot regenerate it. It can't be repaired. The newer thinking is that some amount of regeneration is possible through a process of cellular replacement and repair. So if you replace the damaged cells, you can get regeneration. So what exactly is cell or stem cell therapy? There are different terminologies. Some people call it regenerative medicine, some call it stem cells, some call it cellular therapy. It's basically all the same thing. So the word stem comes from the stem of a tree. And just like from the stem of a tree, you have branches, leaves, fruits, etc. There are some cells from which all other cells of the body arise. So basically, cell therapy is using healthy, good cells to replace damaged cells. I'll repeat that. You take good cells, healthy cells, and you replace the damage. Like these blue here is the damage in the brain of a child with autism. If you give stem cells, the damage gets repaired. So I show you this on the left-hand side. You see an X-ray of a fracture. You can see this bone here. This is broken. So this is a fractured leg. And I ask you, if you were to have a fracture of the leg, would you do physiotherapy or exercises on a broken bone? Would anybody do exercises on a broken bone? Would you do rehabilitation on a broken bone? You would not. You would go to an orthopedic surgeon, he would fix it with plates and screws. And now, once the bone is joined, you would now do therapies. But in our children on the autism spectrum, they have a part of the brain that's inactive, not working, and we are making them do therapies to make these activities happen, but the brain is not working there. No matter what you do, you are not going to get results. If the speech area is damaged, you can give all the speech therapy you want in the world, your child is going to remain nonverbal. So we are now doing rehab on a damaged brain. What if we did rehab on a repaired brain? This green you can see is repaired. Wouldn't we get better results? So that's all I'm trying to say in today's talk. That we have not even looked at their brains, so nobody even knows that which parts of the brain are damaged. But the good news is there is technology that can tell you what part is damaged, and most important, there is technology which can repair the damage. So this I show in a lighter tone that I became a neurosurgeon in 1992. And in 1992, if I had to do a video filming, I needed a camera like this. If I had to take still pictures, I need a camera like this. If I want to type something, I used a computer. For music, I listened to a player. For a telephone, I used this. We didn't have mobile phones in 1992. For calculation, I used a calculator. I watched television on a screen like this. I used a torch, compass. And if in 1992, when I became a neurosurgeon, somebody told me that all of this would one day be in the palm of your hand, it would have been science fiction, but it has happened in our own lifetimes. Likewise, if somebody had told me when I was a medical student that one day there would be something which would modulate the immune system, which would cause neurogenesis or improve neural cell function, which would prevent death, which is apoptosis, which would release growth factors, which would improve the myelination or the covering of the nerves, which would improve the blood supply, which would help to multiply and differentiate, that it would be science fiction that time. But today we have stem cells that can do all of this. So this is science fiction when I was a student, that in my own lifetime, I've had the privilege to actually see and work on. So there are a lot of papers all over the world. There are 291 papers showing the usefulness of cell therapy in neurological conditions. And you can see 130 papers on orthopedics, wound healing, cardiac, etc. So there is a lot of work worldwide on this subject. In autism, there are over 30 papers. Cerebral palsy, there are over 40 papers. And spinal cord injury, head injury, stroke, you can see. So worldwide, there are a large number of publications on cell therapy in neurological disorders. In the medical field, if any of you are doctors, Bible, Quran, or Bhagavad Gita is actually a book called the Harrison's Principle of Internal Medicine. This is like the standard book. And in this book, they've introduced a chapter on regenerative medicine, and many neurological conditions that we are now treating are actually mentioned in this book. The most prestigious recognition in medicine is something called the Nobel Prize. And 3 times the Nobel Prize in 1990, 2007, and 2012 has gone to stem cell research. So it has got the most prestigious recognition. The work that we do, stem cells and bone marrow, this actually got the Nobel Prize in 1990. So how do stem cells work? First, they have the ability to multiply. So a single stem cell can become multiple stem cells. Most important is the ability to convert. So the same stem cell can become a nerve cell, a heart cell, a blood cell, a muscle cell, or a fat cell. So this is the beauty, that the same stem cell can become any cell of the body depending on where you keep it. So they have the ability to multiply and they have the ability to convert. They also improve, they attract fresh blood, and so they improve the blood supply, and they release certain positive chemicals called growth factors. So this combination results in repair, regeneration, and replacement of the damaged tissue. The ability to multiply, convert, improve blood, and release positive chemicals. So how does stem cell therapy work in autism? It improves the blood supply to parts of the brain where the blood supply is rest. There's release of growth factors. It prevents cellular death. It protects, does neuroprotection. It improves the connectivity between neurons. the endogenous stem cells get stimulated. It has an anti-inflammatory and an immunomodulatory role. So how stem cells help in autism is very clearly defined in this slide. There are two types of stem cells. You can take stem cells from the child or from the patient itself and put it back. That is called autologous, which is a procedure. Or you can take a donor cell, which are products sold by companies, which are from somebody else. So this is the broad division of stem cells. They can also be divided into embryonic stem cells where the life starts when the father's sperm and mother's egg comes together and forms a fertilized egg. This then multiplies and becomes a grape-like bundle on the fourth and fifth day of life. All of us were a bundle of stem cells called the blastocyst. And from this, the whole body was formed. That means these cells have the potential to become any part of the body. But the use of embryonic stem cells is controversial, so we don't use this at all. You can also get stem cells from the umbilicus. So these are what the donor cells are. And nowadays in children, actually, they're preserving the umbilical cord. So that could also be used. But what we are using is what are called adult stem cells. We take from the bone of the child itself. And these are called autologous. And we prefer this method because this is from the child itself. So this is what we do. After this, my entire talk will be focused on autologous cell therapy. I'm not going to be referring to this because we don't do this. The last type is a combination where the outside is from us, adult, and the inside is embryonic. It's called iPSC. We are not using that either. So we work with adult stem cells because they are safe, they don't form tumors, they don't get rejected, and you can get them from a single needle. You don't have no surgeries required, and there are no ethical issues. How do you put the stem cells back? You can inject it into the lower back, into the spinal fluid with a needle called a lumbar puncture, and then it can go all the way to the brain. This is the method we prefer. You can also inject it intravenously. You can inject it into the artery. You can give it into the muscles. We use this method for a disease called muscular dystrophy. You can also put it through the nose and directly inject it in the brain as well. So there are different ways of putting the stem cells back, but this is what we do. So this is our procedure. We put a needle into the pelvic bone just above the hip bone. So this is the hip. Above that is the pelvis. And we put a needle into it and we aspirate and we take out the bone marrow. The amount of bone marrow we take out depends on the weight of the child. And this procedure takes about 15 minutes. Once we've taken out the bone marrow, we take it to the laboratory. Here we sort of filter it and we separate the stem cells from it. And once the stem cells are ready, we inject it with a needle, with a very thin needle. We inject it into the lower back because then the fluid of the lower back takes it straight to the brain. So in the whole procedure, there are only two needle pricks. With one, we are taking out, and with one, we are putting back inside. So there is no injection. So here you can see the bone marrow coming out. We take it to the laboratory and we separate the stem cells, and with a very thin needle, we are injecting it back. Now I'm going to present our published clinical work of cell therapy in autism. So we wrote the world's first publication. The world's first publication came from us, the second from China, third from Italy, the fourth and fifth were from the United States. The sixth again was our paper from India, then papers from Vietnam, Iran, and the US. So this is the world's first scientific paper, which we published in 2013, where we showed our results in a small group of patients. That was 32 patients, and we showed a 91% improved. The improvements were in social relationship, emotional responsiveness, speech, behavior, sensory aspects, hyperactivity, attention, and eye contact. Above, you see the percentage improvement in all these symptoms. Our next paper was published in a prestigious journal, the American Journal of Stem Cells. And here again, the paper showed cell transplantation as a novel therapeutic strategy in autism. And this was a larger size, 254 patients. And here we showed a 95% improvement. So again, you can see social interaction improvement in 67%, eye contact 80%, attention 80%, stereotypical behavior 53, aggressiveness, hyperactivity, self-injurious behavior, sitting tolerance, command following, speech, communication. So you can see a significant percentage improvement in all these symptoms, 95%. But what we found, interestingly, was that there was an age differential. So kids below 5, 98.8% improved. Between 5 to 10 years, it dropped to 95%. And after 10, it was 90%. So obviously, the earlier we treat, the better results we get. And that is why treating below 5 years gives us the best results. As the age advances, the results become lesser. This is from our data. And we looked at the objective evidence on brain imaging. So here, the PET scans is done on two machines. One is a Siemens machine. The other is a General Electric machine. That's why the pictures look different. So this is on a Siemens machine. Above, you can see the blue is the inactive part, the damaged part. And you can see 6 months after the cell therapy, you can see that this damage is much reduced, almost gone. Here again, this damage is much improved. Here, this damage is much improved. So this is the results on a Siemens machine. On a General Electric machine, the scans look a little different. Here again, you can see the damage before, and you can see within 6 months, the function is improved. You can see the damage before, and you can see in 6 months, the improvement. So there is a substantial improvement on both the machines. This is our next paper, which is in what is called preprint, is to be published shortly. This is data from over 1,000 patients. And again, you can see similar results in all the symptoms: attention, command following, eye contact, sitting, social interaction, hyperactivity, communication, stereotypical behavior, aggressiveness, self. You can see the percentage of improvements. And this is the scales, percentage improvement in the different scales like ISA and CARS. And this is again to show the different symptoms, how they responded, and that all of these are what is called statistically significant. So for us to say that treatment is working, we have to show that the the score and the post mean score of all the patients was statistically significant. And again, here we see a similar kind of result. This is a larger data, but again, you can see depending on age, the results keep on dropping. So age seems to be a very important criteria. And again, here you can see the improvements before and after, on different scans. Now, what I presented to you right now was our own published work. Now, I'll share with you work in some other countries. So these are the papers we'll quickly look at. This is our paper, and like I told you, we had a 91% improvement. This is a paper from China, Yong Tao et al., and here they showed a 88% improvement. This paper was from Dawson et al. In the United States, and they showed a 90% improvement of 90% patients improved. This is the next paper from the United States by Kimberly et al., which showed 90% of the patients improved. This paper is from Mexico by Martinez et al. Here they showed 95% of the patients improved. This paper from Vietnam by Thang et al. Again, 93% of the patients showed improvement. This paper by Bradstreet from Italy, here they showed 78%. This is amongst the lowest results from all the published papers. And this is what is called a systemic review or meta-analysis. What I showed you before was individual work. This is a collection of different people's work. So here they studied 461 patients from 11 different studies. And again, they found that it is safe and it improves the patients. This is another systemic review or meta-analysis. They studied 325 patients from different studies, and they found it is safe and effective. So that was my data on cell therapy. Not only did I share with you our own clinical data of improvements, which symptoms improved, what percentage of the symptoms improved, what were the changes on the PET CT scan. We discussed all of that. But what you have to understand is, along with cell therapy, neurorehabilitation is also very important because the brain is a computer. A computer's got hardware, and a computer's got software. So the cell therapy that we do only repairs the hardware, but the software comes from rehab and from the teachings at home. So rehab is again very, very important. We can't do without rehab. Parents have a misconception: oh, we will give our child stem cells and our child's autism will go away. No, the stem cells will only repair the damaged hardware. Unless you put in proper software, you're not going to see improvements in the child. So, comprehensive rehab is all of these things. Unfortunately, in different parts of the world, there is more emphasis on one or the other. In some parts of the world, it's only psychology and ABA that gets more importance. In some parts of the world, occupational therapy gets more important. In some parts of the world, speech therapy. We believe what is required is all of these things together. So, rehab is the conventional rehab that we know of, and there are some newer rehab technologies. So, ABA we are familiar with. And this is ABA happening at our hospital, occupational therapy. This is our occupational therapy. There is speech therapy that is happening at our institute. There is physiotherapy. Now, this I want to focus on. Most people believe physiotherapy has no role in autism. We have found that these children do have physical issues such as motor coordination, problems with their tone, gait, postural stability, etc. So, physiotherapy is important in these kids as well. There are various art-based therapies that we can do in autism. So this is what I want to share, that we need comprehensive rehab and not just one type. So this is the point I want to make with rehab, that we must find access to all of this. Sensory integration is, again, we are finding it extremely useful. That is our own SI room. Um, and the one thing I want to focus on is aquatic therapy. So over the last 6, 7 years, we found that aquatic therapy to be very, very useful. You can see all the improvements I've listed, in particular sleep patterns, hyperactivity, oromotor control, etc. So aquatic therapy is not swimming. People think aquatic therapy is swimming. No, aquatic therapy is therapy in water, and it requires skilled trained therapists to be able to do this. And we find this very, very useful. So rehab enhances the effect of the stem cells. It promotes cell integration, survival, improves blood oxygen, neuron connectivity, it makes new pathways, reduces inflammation, and promotes release of growth factors. So they both work in tandem. It is not which is more important. Is cell therapy more important than rehab? No, both have to work together. Then we have, integrative therapies. You may be aware of some of them, but they are hyperbaric oxygen, gut cleansing, the ozone therapy, acupressure, and supplements. So I'd like just very briefly run over some of these. So we believe hyperbaric oxygen is extremely important. This is the hyperbaric chamber at our institute. We believe that, when you combine both, you get a little better cumulative effect. So it is our belief that hyperbaric oxygen should be combined with the cell therapy. So this is the hyperbaric chamber that we have. The parent goes in with the child very comfortably. Most children enjoy it. How does hyperbaric work? So above you see, this is our blood vessel. In our blood, we have a liquid, and we have cells like red blood cells, white blood cells, and platelets. Now, all of us presently are breathing oxygen at 1 atmospheric pressure. At 1 atmospheric pressure, the oxygen that we breathe gets attached to the red blood cells, the hemoglobin in the red blood cells. And only the red blood cells carry oxygen. In all of us, all of you listening to me right now, me, in all of us, only the red cells, the red blood cells, the RBCs are carrying oxygen. But in a chamber, when you give oxygen under pressure, the oxygen goes into the liquid of the blood, and the entire plasma is now carrying oxygen, which means the body oxygenation becomes much, much more as compared to this. Then there is ozone therapy. So oxygen is O2 and ozone is like an activated oxygen, O3. There are a lot of beneficial improvements, from improving the oxygenation, lowering the inflammation, helps in the immune and the endocrine system, improves the gut health, releases growth factors. So we are finding ozone to be an extremely useful treatment form. It can be given through the ear, like you can see. We use rectal ozone for gut cleansing, and now we are finding ozone cupping, where there's a cup and we put it around the mouth. We are finding that this helps in faster recovery of speech. We use acupressure or deep tissue mobilization, which is also helpful. Now, we also work on the gut. So what we do is, when you come, we do a detailed gut microbiome testing. This is not a routine test. This is a very detailed test. Its report is about in 25 pages, which looks at all the infections in the body. Is it viral? Is it bacterial? Is it fungal? It also looks at all the chemicals, the neurotransmitters, the hormones. It does a very detailed study of whatever's happening in the gut. So we identify what are the pathogens in the gut, and then we do gut cleansing using rectal ozone therapy, and then we try to restore the gut balance through certain dietary recommendations. So it's important that the toxins from the digestive system are removed, and we are finding that by doing this, we are getting faster improvements in speech and also the behavioral issues. Diet is very, very important. You're all familiar with. There are some foods to eat like pro and prebiotics, a ketogenic, gluten-free, casein-free diet, camel milk, curcumin. These are known to benefit. And of course, the things not to eat are sugar, additives, pesticides, etc. We all are aware of a ketogenic diet, which is a high fat, enough protein, and low carb diet. We do micronutrient supplementation. So, depending on what are the deficits, these are the various things that could be supplemented, the elements and vitamins. And this I spoke to you about the MTHFR mutation. So, if there's a mutation, then we have to give methylfolate in a way in which it can be absorbed, bypassing the genetic defect. So we have found that combining ozone and hyperbaric oxygen has enhanced improvements. So these are the combination improvements of hyperbaric and ozone therapy. And that's why we believe that giving it together is much more beneficial. Now, we studied our data. For example, till 2019, we were doing only cell therapy. From 2019 onwards, we introduced integrative therapy. So we looked at the data of both. So 1,400 patients, 714 had taken only cell therapy and rehab. 730 had taken cell therapy, rehab, plus integrative therapy. And what we found was that the ones who took only cell therapy and rehab, the average improvement was 87%. Whereas in those who took the integrative therapy, cell therapy with integrative, it was 91%. So you have roughly 4% improvement when you take the integrative therapies. And this is just to show you in the different symptoms, what are the improvements. So you find that when you combine cell therapy with integration, in all the symptoms as well, the improvements are better. The scores also, on an average, are much better in the cell therapy with integrative. And we did the PET scans, and this is a very technical slide, but we saw that even in the PET scans, the improvements were more when we combined cell therapy with integrative.
When we came here to
So I shared with you, how some parents felt when their child was diagnosed with autism. Now let's listen to the same parents, how they feel after their children underwent cell therapy.
When we came here to NeuroGen, she was totally nonverbal. She had no speech. Immediately after the first shot of stem cell, that's when she started now having one word.
Less than 2 weeks from that, he was using single words like
C for cat.
magically the water came out from the mouth, mama came out from the mouth.
F for fish.
I remember that first day she called me mom, I cried. I cried because it was so emotional.
Within about like 40 days, a remarkable improvement. Her eye contact is fabulous. She started sleeping on a time. That is wonderful.
Biggest game changer for Prithvi is his expressive language, his speech. He started speaking more. He even started telling us what's going on in school.
He's able to listen, and he's able to understand more, and he's able to learn new things.
So after stem cell, what I saw was he was able to read sentences in his mind.
He has improved his eye contact. If he wants water, if he can't reach, he'll come and ask, he wants water. We gained so much progress in less time.
She started responding to her name.
Is Eliana a big?
No.
Eliana is a?
Eliana is a good girl.
Then his writing has improved. He can read.
C for dog.
Single word to sentences.
My girl finally she had speech. Please give me food. Can we go for a shopping?
Blueberry.
Cranberry.
And orange.
Orange.
And mixed fruit.
Mixed fruit.
High five. Now he is able to put things in sentences. Let's put on our shoes. Let's go to the car. Let's go to the plane. Let's go home. You feel now, yes, you got your life back.
She improved her performance in the school, her behavior, has improved. Her understanding has improved.
There are certain things which I have never taught him. Huge improvement in academics, English language, Bengali, that's Bengali is his mother tongue, and also a little bit of Spanish. He can tell you the date 7th February 2030. What will be the day?
From special needs self-contained class into a gen ed class, he would come and say, I got 100 in math today. I was the only one who got 100 in math.
My child started showing this extraordinary education skills. He can do calculations, he can do square root, cube root. I have also tried a little bit of cos theta, tan theta, which is class 9-10 level with the options, and he has also given that.
The boy who was not responding, even if you call his name at the beginning, he is now, when someone walks into the room, he spontaneously, automatically says hi. He is able to grab and tell you to read for him, and you sit down and listen and watches and you read together. And he reads after you, and he's able to write. His handwriting improved.
Now I'm not scared that he would take off and run away, because I think he goes out of the house and he knows what he wants to play. If they say it's dangerous, come back, he comes back. So that stress is reduced.
I taught him my phone number for emergency purpose. I also taught him the address. He is able to tell me full address, and he is able to write it down so that if anything happens, he is able to say my phone number.
He understands emotions. If you're happy, he's happy. If you get upset, he knows you're upset. I have seen a lot of huge differences. It's like giving a second life to a child by doing the stem cell.
She could do short call on her own, but long call with support. But after the second one, he is fully trained.
हर बार stem cells से improvement है, and the improvement are permanent.
We've seen like significant improvement, hitting all his goals, and in fact we are now like figuring out what are the new kinds of challenges we need to set for him.
There are children with a special need, so they come to us and speak to her how Saisha is doing such a good.
My child has got some ability to fall back on and to make that as his career or the reason why he is here in this world.
The stem cell is a hope for a parent. You might not see the results in the same day or the same minute, but you can see faster and much better results.
He has, the two big sisters are both of them public health nurses. And mom is a nurse, and we are a medical family. We see and observe him every single day, and we ask ourselves, it's just a few more years, Abdul Hakim will be independent.
So that is just, the same parent.
He was screaming, he was crying, I was trying to hold him, and we were like 45, 50 people on that bus.
Father is a doctor, cardiologist, mother is a nurse.
And so on the way back, this woman just let it go. Would you shut up? I felt like a bullet went through me. I just thought, wow. I was like, oh, and I just said, my son's autistic, he can't help it.
He would flap like that. He would walk on his tiptoes, look at the wall and be talking to the wall.
He started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards. We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings. Gradually seemed to improve overall. His mood, he was so much calmer. There weren't these horrible, horrific tantrums. They were decreasing, and when he would have a tantrum, I could talk him out of it. We could engage with him and we could problem solve. He was able to sit at the table with us. He was trying new and different foods, put the food in his own mouth and do it consistently. As a parent, it's very exciting.
This is the first time since his stem cell that he has gone to a regular school.
Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months. We saw the PET scan images. The areas that were hypoactive or non-active were warm. There was activity there. That moment will always be, a memorable moment.
People say, oh, he's a different child now. He's a lot calmer. He's talking normally. He looks like he's grown up.
He'll say, Mom, I love you. And those words had never been out of his mouth before.
stem cell therapy offers the potential for a cure. It has been a game changer.
He's doing very well now. He's stopping in his school and he's completely off the spectrum. This child now has traveled to Europe all by himself without his parents. So, those are the kind of improvements that are possible. So, what's the scientific basis of our work? So, all our work is published in peer reviewed scientific journals. We have over 100 papers, 16 in autism, 15 in cerebral palsy, etc. This is very important because wherever you choose to, do cell therapy, you should always find out if that center has their work published in peer-reviewed journals. Peer review means somebody outside of you has cross-checked your data, verified its scientific content, authenticity, and ethical principles, and only then do journals publish it. So that's why peer review data is data reviewed by somebody else, and so it's more authentic. So we have over 100 papers, 16 in autism. We have written chapters in books. There's an international book, Recent Advances in Autism. They introduced a chapter, Stem Cell Therapy in Autism, and they asked us to write this book on cerebral palsy. It's a European book by Intech. Again, they introduced a chapter, Stem Cell Therapy in Cerebral Palsy, and we wrote that. This book on physical disabilities, again, we wrote the chapter on stem cell therapy in pediatric neurological disabilities. We have published 18 books and we've treated over 15,000 patients from 103 different countries. So, from all the 6 continents, we've had patients come to us in India to take the treatment. We work out of 2 hospital facilities. The main building is the NeuroGen building. It's an 11-store facility dedicated for this. And we have a NeuroGen annex at KLS Wellness, which is a smaller facility. Very briefly, we treat cerebral palsy as well. In cerebral palsy, there is brain damage, but the effect is more in the body. Either one half of the body or just the lower legs or the entire body can be affected, and there are different descriptions of this. The damage, as you can see in cerebral palsy, is more severe. You can see this is more blue and darker. And there are different medicines, but they only help in the convulsions or spasticity, etc. There are some surgical procedures that help as well, but they don't take care of the problem. They help in the periphery. With cell therapy, you can see on the left-hand side is the brain damage, and 6 months after stem cell, you can see the brain damage is gone. So even more severe brain damage in CP can be repaired, as you can see in this slide, by cell therapy. And again, our work is published in international journals. We were not the first to publish, but we were among the early people who published the study of autologous bone marrow cells in cerebral palsy in this international journal. In this paper, we had studied 184 patients, and we found that there was a significant improvement with all these things. And here is just a video of a child from Kenya. You can see when he came to us, he was completely wheelchair bound, unable to use his hands and legs at all, could not walk. And you can see after the treatment, he's able to get up by himself. He can wear a t-shirt. All these things were impossible. He could not use his hands at all. Now he's actually packing a bag, charging his mobile, able to take out a bottle of water, open it, and drink. For the mother, this was like something so important and amazing. And now you can see that he's walking. A completely wheelchair bound child is now able to walk after cell therapy. And then there is intellectual disability. Again, the world's first paper on cell therapy in intellectual disabilities written by us. This was a control study. So we had 58 patients, of which 29, we divided them into 2 groups. 29 took cell therapy combined with rehab, and 29 took only rehab. That means no cell therapy. And then we compared the results. So you can see now, for example, cognition. The group that took the stem cell and rehab, 55% improved, with only rehab, 17%. Same thing, memory, 88% improvement in memory with cell therapy, only rehab, 12%. Now you can see the same thing for all. Problem solving, 50 versus 24. So rehab does help. As you can see, only rehab also helped. But cell therapy with rehab, as you can see in the blue, was always much more in everything, in problem solving, in understanding of relationships, and social inhibitions, toilet training, command following, eye contact, aggressiveness, attention to concentration. So the combination of cell therapy with rehab is better than rehab itself. And these are just the scores which show again that cell therapy, in the group of cell therapy, the results are better. We've got 5 papers on intellectual disability. Now, a question in all your parents' mind must be, how safe is this treatment? So, we've never had any major complication, like none of our children have deteriorated. But there are some minor adverse events, like 3% of our children develop epilepsy, but this is in children who have epilepsy before. 10% of the kids get a headache which lasts for 1 or 2 days. This is in the hospital itself. It never happens at home. And a couple of kids may have some nausea, vomiting, local pain, etc. But we have published this as well. So I mentioned seizures as a complication. People only publish their positive results. We have published a paper showing seizures as an adverse event of cellular therapy. So our adverse events are also published. Now, what are the ethical aspects of our work? So all our cell therapy work is done with permission from and under the oversight of a health ministry, which is CDSCO registered Institutional Ethics Committee. In America, these are called IRBs. They are called Institutional Review Boards. In India, they're called IECs, Institutional Ethics Committees. So our work is with their permission and with their oversight. So my conclusions are that management of autism is multidisciplinary. We are going to need everything, all kinds of rehab, cell therapy, and integrative therapies. So my conclusions are that neuroimaging technologies are giving us better information about which parts of the brain are affected. This is something which was not known some years before. Newer biochemical investigations are telling us better what is happening to the metabolic pathways involved in autism. And new multidisciplinary treatment. So combination of cell therapy, neuro rehab, and integrative therapies, you get the best possible results because it helps resolving the underlying pathologies or problems of autism. So it reduces the symptoms and basically improves the quality of life. All these treatments are safe and effective. A point to be noted that this is not, cell therapy is not a cure for autism spectrum or CP. It has to be combined with rehab. Also, presently, it's not a standard of care, but may be considered to be a clinical option. So this is the combination that we need. We need to do brain imaging. We need to do conventional and special rehab, cell therapy, and oxygen-based therapies. So this is what we presented at the talk. And what we have noticed is the best results are achieved when parents have a complete, absolute acceptance of the child the way the child is. They have a complete understanding of what is happening to the child. We found when the whole family works as a team, the results are better. We found that having the whole day properly scheduled is much more helpful to these children. We have to combine cell therapy with rehab, with correcting the micronutrient imbalances and integrative therapies. So when we do all of this, we get the best results. The good news is that on 1st January 2026, we will be starting our treatments in the Bahamas. The hospital which we have taken, which we have acquired, is almost fully functional. There's just some interiors going on. So we're going to be all close to you very soon, and it's going to be exactly the work happening at NeuroGen in India. The same work will be happening there. So that's the good news. Actually, although it says 1st January, I think we'll be starting a couple of months before that. Now, I'd like to end with the views of the Prime Minister of India and the President of the former President of the United States on stem cells. The world's two biggest democracies are India and America. And the Prime Minister of India is talking about stem cells. The former President of the United States is talking about stem cells. So I'm very fortunate that in a book that I have written, Honorable Prime Minister Narendra Modi ji has written an introduction. It's not very often that you have somebody of the stature of Shri Narendra Modi writing an introduction for a book, but I have an introduction written for one of my books by him. It's a book on muscular dystrophy where I talk of the role of stem cells. That is myself presenting him a copy of the book. And this is a speech in Parliament, the Honorable Prime Minister.
जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा?
Parliament on stem cells.
मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया. मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या? हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें.
So that is the Indian Prime Minister talking in the Indian Parliament on the importance of stem cells. And now we'll see what former President Barack Obama had to say about stem cells.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary. Today.
So with that, I'd like to thank you for your attention. With that, I complete my presentation. I don't know, is there a question answer session? Are there any questions on the chat group I can answer? All
At
right.
the time, there's no questions, Dr. Sharma. Unless anybody has any questions, please type it in the chat.
Well, if anybody has any questions, please feel free to ask me on the chat. I'm happy to answer any questions. All right, we'll wait for a little while. If somebody has any questions,
Dr.
we will
Sharma, somebody is asking, are you able to share your presentation?
Yeah, we'll do that. We will share it with all the people who participated. We'll share our presentation. Yeah. Any other questions?
There's one more. It says, hello, doctor. Does stem cell therapy work if someone has mold?
Yeah, it works. So we have several of our children have been diagnosed with having mold by the functional doctors in America, and it works just as well. So there is no difference in the clinical results, and we've actually studied that in children who have mold and who don't have mold, because we are repairing the brain damage caused by all of this. We are not trying to fix the treatment of mold is a separate treatment. What we are doing is fixing the brain damage. So it works just as well. All right, if there are no more, okay,
There's one more question, Dr. Sharma. How long is the therapy and rehabilitation?
Okay, so we have two options. We have a 1 week option and a 2 week option. In the 1 week option, we only give the stem cells and the rehab. In the 2 week option, it is combined with the hyperbaric, the ozone, the gut cleansing, all of that. So we have two options, a 1 week and a 2 week option. We recommend the 2 week option because, like I showed you, when we studied our data, we found that 91% improvement in the 2 week program as compared to the 87% in the 1 week program. So these are the basic options, a 1 week and a 2 week.
Another question, can we do the 1 week first and then do the other programs another time?
No, it is best that they are both done together because the results are better together. If you separate the two, you don't have a cumulative benefit. So what we have found is when you combine the two, you get a better result. So it's just better to do it together.
Okay, next question. Autologous and allogenic stem cells, why do you think the patient's own cells work better compared to donor-derived?
Okay, so the difference is that first, donor-derived cells are from donors that we don't know. What companies do is they go to various hospitals, they collect the umbilical cord and the placenta, which is normally thrown away in the garbage. They actually collect it, they extract the stem cells, they manufacture it as products. So it has got a preservative. So donor cells have a preservative. The preservative for stem cells is something called DMSO, which is actually harmful to the brain. Whereas autologous, the cells we take have zero preservative. They're just natural. Second, donor cells are cryo-frozen at minus several degrees. So they are frozen cells and they're lying frozen for several months. Ours are at room temperature. We take them out and put them back immediately. Third, what we have noticed is that the body tends to accept its own cells much better and faster than donor cells. And we had done 10 years of basic research in the laboratory with various animals. And we had found that when you use donor cells, at the injury site, the acceptance is not as much, whereas cells from your own body get accepted better. But most important is the donor cells can't be injected like we inject it into the spinal fluid at the back. Donor cells can't be injected because of the preservative. That preservative is harmful to the brain. So you have to inject it intravenously into the blood. Now, when you inject it into the blood, it first goes to the right side of the heart, then goes to the lungs, then comes to the left side of the heart, and then the left side of the heart sends it to the brain. Now, a lot of the cells get trapped in the lungs. So not all the cells reach. So basically, if I had to compare, I mean, would you rather you take a fresh oranges and give your child fresh orange juice, or would you rather give your child a canned orange juice that's commercially available at a supermarket? Both are orange juices. But obviously, if you take fresh orange juice, it's healthier because it has no preservative, it's not frozen for several days, and you know where you're getting it from. Whereas, so the difference between the two is that of a canned orange juice versus fresh orange juice. And so the safety profile of autologous cells is much higher. And we have found that the clinical results are also much better.
Thank you, Dr. Sharma. There is another question. Do the spinal headaches go away, and how about seizures?
So the spinal headaches go away within 48 hours. It happens if it happens only during your hospital stay. We've never had any parents who've gone back home and said, "Oh, now the child has headache." So if it happens when you are with us, and it lasts for 48 hours. Now, this is a peculiar headache which goes away on lying down. It only comes when the child sits up. So for the 2 days, the child will refuse to get up. He'll just be in bed. And so they don't really have the headache because they're lying down. But the moment they get up, they'll have the headache. But anyway, this goes away in 48 hours.
Okay, a comment. I have twins. Would you recommend to do both together or one at a time?
No, we recommend both together simply because we've found that because there are various phases of the treatment, the investigation, the cell therapy, the rehab, the follow-up. And we find if there are two children, because very often we've got several families with three children. And then everything goes in a smooth movement. Whereas if you do both separate, you have to repeat everything. You have to come at different points and, do scans at different points and cells at different points. So it actually doubles the burden on the parents to do it separately. So our recommendation is to always do them both together. It's much easier for the family.
Thank you, Dr. Sharma. Next question. What makes the patients go for multiple rounds of stem cell therapy? Is it the kid's age or the extent of brain damage?
So actually, it's a combination of both. What we have found is that younger kids, so we very often have kids coming between 2 and 3 years. There are some doctors who send the kids immediately after diagnosis. We have some doctors from different parts of the world. And there we find that they improve in a single shot. They never have to come back. So age is a major criteria. Also, the amount of damage. So our own data shows us that, I showed you that blue on those scans. So if the blue or the hypermetabolic area is 15% or less, these children require only one treatment. If it is between 15 to 30%, they require two treatments. If it's 30 to 45%, they require three treatments. If it's more than 50%, they require four treatments. So a lot of it is based on, so it's a combination. You're very right. It's the age as well as, the amount of damage. Also, we found girls tend to do better than boys. So girls require lesser shots as compared to boys. So there are various factors. Also, the amount of rehabilitation that the children are getting, that matters. So those who enter an aggressive rehab program are less likely to require more shots. So it's actually multiple factors.
Thank you, Dr. Sharma. Next question. How do stem cells help in reducing neurological inflammation?
We would like to get a. Basically, what the stem cells do is, like I said, it's very technical to get into the technical details, but they modulate the body's immune system. So our body's immune system is the one that causes inflammation anywhere. And stem cells, one of the main things is by modulating, it's called immunomodulation, they result in lower inflammation. So there is a lot of data to go that the inflammatory markers in these kids, they reduce. On the scans itself, we are seeing that the inflamed areas are now settling down. So it doesn't work on the inflammation, it works on the immune system, which is causing the inflammation. This is as simple as I can make it. Actually, it's far more complicated than that.
Thank you, Dr. Sharma. The visa would be a medical visa.
No, you need a medical visa. Yeah, so we need a medical visa, which is not difficult to get. It's pretty easy to get a medical visa. We will send you all the papers and documents, and our coordinator will guide you. And it's easy to get a medical visa.
Thank you, Dr. Sharma. My question is, does this treatment only apply to autism or it treats other illnesses?
Oh, many illnesses. So I just, because this seminar was for neurodevelopmental disorders, I spoke only on autism, cerebral palsy, and intellectual disability. But we treat muscular dystrophies. We have treated more than 3,000 muscular dystrophy patients. We are able to treat paralysis caused by spinal cord injury. A lot of people who are paralyzed in both their legs and hands because the spine fractures, we're able to make them walk. We've treated a couple of thousand of those. We treat patients with brain stroke who have a brain stroke and they are paralyzed on one side. They show dramatic improvements. We treat a lot of dementia and Alzheimer's, and we've been able to successfully reverse both dementia and advanced Alzheimer's with our cell therapy. Then we have various other neurological conditions like there's something called motor neuron disease. In America, it is known as ALS, which is what Stephen Hawking had, and there is no solution to it. It's got a 95% mortality within 5 years. And we've treated several of these patients and we were able to save their lives. Many of them are living many, many years beyond what they were told they would live. So we are treating many conditions, but at our institute, we only treat neurological conditions. We don't treat orthopedic, or any other cancers, and we don't do that. We focus because I'm a neurosurgeon, so we only treat all kinds of neurological conditions. All right. If there are no more questions, no, thanks. It's covered everything so much. All right. Thank you so much. Thank you so much, everybody, for spending time with us. I wish you a good evening. I wish you a relaxed weekend. And I do look forward to seeing all of you sometime at NeuroGen. We will, once the situation stabilizes here in India, which is so far it looks stable, we will be traveling to America again. I do understand that many of you want to meet with me, and I'll be happy to do that. What we can also do is, if any of you want to do a separate individual virtual consultation with me, you can do that. It's free of cost. We don't charge anything for it. There is a process. You have to make a request to you can make a request. You can send us an email or you can send a message to either Apurva, Soma, or Anamika, and one of our people, either Jigyasa or Larissa, will coordinate, because very often parents don't want to talk about their child, on a more public platform. So I'm happy to do these virtual consults with you. There's actually a long waiting list. There's a waiting list of about 2 to 3 months to get an appointment for that. But for all of you on this group, I'm going to give special priority, and we'll make it happen within a week. So should you want to talk to me directly, it'll be a half an hour consult where we can have a question answer session. You can ask me individual questions about your child. So I'll be happy to do that. So please take advantage of that and do. I said it's without any cost. It's just that uh, the timing is something, we will adjust to your timings. We understand there are time zone issues, but whatever time we give, we can only do it in that time slot. So thank you again. Once again, my apologies for not being there in person. I wish I was in San Francisco just now, but this is life. Things happen, and we are trying our best to do whatever is best possible under the circumstances. Once again, I have to thank first the efforts of Apurva, who behind the scenes has done amazing work. I mean, there's a lot of effort that goes into organizing these things. I want to thank Soma and Shaq both for everything they've done. They've been on on their TikTok. You've spoken a lot about us, and thank you, Soma, and thank you, Aramika and Pushkar. Both of you have been pillars of support. Your being there means a lot to us. Thank you, everyone. And if all is well, we will end the meeting. Thank you. Bye bye.